Dr. Michael Graven says diabetes is the #1 cause of death on St. Lucia. The disease is also the #1 reason for all hospitalizations. The medical researcher who diagnosed the country with the highest rate of diabetes per capita in the world says the disease is crippling St. Lucia. Dr. Graven says the situation is critical and needs to be addressed immediately.
There aren't enough spaces to do dialysis now. There is someone getting a leg, and in many cases both legs, cut off at one of the hospitals every week. Every week there's someone having that happen. The rates of which amputations are occurring, which is one of the complications of diabetes, is this peripheral vascular disease and peripheral neuropathy, is epidemic. There are lots of people here in St. Lucia who are shut-ins because they've lost both of their legs already.
Dr. Keith Mondesi says it is time for action. The health minister says a management program is critical to curbing this dangerous trend. He convened a meeting to design that program on Saturday.
We have a very high demand for dialysis because kidney failure. Now, kidney failure, most of the kidney failure we get here is as a result of diabetics, high diabetics. So what Dr. Graven has come back now, we said, now, Dr. Gravener, we want you to solve and give us a program that will manage the diabetes that we have here. So now we are setting a program for the first time. It may be the first one in the world that we will now know how to solve it and how to manage it.
The call for action is also coming from the St. Lucia Diabetic and Hypertensive Association. The president, George Eugene, says the association continues to educate the public on the dangers of the disease, but a lot of work still needs to be done. He says increased public awareness campaigns need to be launched.
And it's all in a work plan. I think we've not really got to where we want right now. I mean, there's a lot of work to be done. There's a lot of things that we need to do. And we've started doing some things, but obviously not at a level that it should be. But we're doing something. We're trying to reach as many persons as possible. We started a program where we're going around the country educating the different districts, the people in the different districts as to how major the problem that we have to face.
Dr. Graven says if the national diabetes policy is successfully implemented, St. Lucia will become the first country in the world to reduce the incidence of new cases and the frequency of complications for people suffering from the disease. Winston Springer Jr., HTS News, Channel 4.